Well, good evening, everyone, and welcome to our informal meeting of the Health Overview panel this evening. I want to welcome everyone for attending this evening. We've managed to put this meeting together virtually in response, really, to the latest Omicron situation, and it has been a rather fast-moving situation. And so I think we find ourselves in, again, sort of unprecedented times. And I just want to welcome you all. And as our Democratic Service Officer mentioned, it's although this is an informal briefing, it will be recorded and uploaded onto the YouTube channel so the public can view it. And there won't be any as departure slightly from the usual procedure of agreeing minutes and so on. So I'm just going to say thank you for Dr. Naz Giovanni and Iona for putting together tonight's briefing. If anyone has any questions, we'll do the presentation. Then if you'd like to use the chat function to put your name in the chat function, and then I can make a note and we can have an order of asking questions and comments. If you haven't got a facility for chat, just put your hand up. But my preference would be for this evening to use the chat function if at all possible. So without further ado, I'd like to hand over to Iona and Naz, who are doing a joint presentation this evening. Thank you both.
Thanks very much, Councillor Sharper. And for those of you who don't know me, I think everybody on the panel does. I'm Iona Liddington. I'm Director of Public Health at Kingston Council. And I'll be using the slides this evening. I won't be able to see the questions. So yes, Councillor Sharper, if you could just direct those to me so I can answer those, or Naz can answer those as we go through. So as we said, unprecedented times, clearly keeping up with the national news. You'll have seen the enormously high rates of COVID we'd had over the last month or so, and you'll see when we look at the Kingston data how that's reflected, and hence the virtual meeting this evening. Currently, so this is our 7-day daily rate for Kingston. We're just under 1,300 cases per 100,000. You can see in the middle column there the sort of new cases that we've been getting on a daily rate. I'm pleased to say they are starting to fall now. We were regularly getting 500 cases a day, which for a borough the size of Kingston is the likes that we've never seen before. But just to say, the rates are still very high, despite the positive news that they are beginning to fall. But we do need to remember that testing behaviours may have changed. We know that before Christmas people were testing a lot. That put particular challenges on getting enough lateral flow tests, for example, and also our PCR test sites were also very, very full. And we've also now had changes to the testing guidance, and therefore if we're not testing as much, clearly we're not going to pick up as many positive cases. So just to reassure you that whilst we have had super high cases, we are beginning to see a downturn now. And this is best reflected in this slide, where you can see from the left-hand side, the 1st of September, with Kingston, the red line, South West London, the gold line, and London, the green line. We've all been tracking a very similar pattern of curve, with the rapid increasing from the beginning of December. The lines there you can see sort of peaking around about Christmas Eve, and a gradual decrease, but still very, very high rates. You can see the South West London rate was over 2,000 around about Christmas. And you can see the number of cases in Kingston, those blue bars, that they're over 500 cases a day on several days, putting huge pressure on our test and trace and our Kingston Stronger Together hub. Clearly, this high number reflecting, workforce challenges as well. In terms of how it looks across London, the darker the colour being the higher the number of cases, you can see that now, as of the 8th of January, a lot of London have moved to the 400 to 800 level in terms of case rate, with some of West London, North London to the east still being even higher than that, but gradually we are starting to see London levels start to come down. If we look at the number of cases per day, you can see again from the 1st of April, this is going back to 2020 now, so the start of the pandemic. And fair enough, we didn't have wide-scale testing at that stage, but you can see how this most recent peak of infection and how sustained it's been really since the lockdown finished. And as we went into the summer, you can see the case rate and the start of a sustained wave with then a rapid peak as we've gone into sort of late autumn and into December. As I say, daily case numbers been decreasing since New Year. So as of the 7th of January, we had 239 cases, and that had brought our average down to just over 300, whereas you can see the week of the 31st of December, it was 420 a day. On Christmas Eve, the 24th of December, it was 440. So, you know, as I say, for a small borough, we haven't seen numbers like this before. How do we compare with other London boroughs? Again, this is weekly case rate per 100,000 population. That's how we can standardise it for different sizes of borough. At this stage, then on the 7th of January, we were the 7th lowest in London. Before Christmas, we were one of the highest boroughs, so we seem to have had the peak a bit ahead of other boroughs, and now we are, other boroughs are ahead of us, but you can still see it approaching 1,400 cases per 100,000. These are all very, very high numbers. In terms of Kingston Hot Spots, again, this varies a bit. It will be down to how much people are testing as well. But you can see in places like New Malden East, we had 152 cases in the 7 days to the 8th of January, but that is in itself starting to come down. Berryland South, 119 cases, Hook, 124, Chessington North, 95. So these are our highest parts of the borough, but you'll be encouraged to see that all of these are beginning to see a drop. But if you look at those case rates per 100,000, you know, around 1,600, 1,550, these are still very high 7-day case rates. In terms of looking at by age group, you can see again with the darker the colour, the higher the case rate, and these are in 5-year largely age bands apart from the 90 plus. You can see that we've had very, very high rates, particularly in our sort of young adults. So you can see there are 20 to 24-year-olds, a rate just over 2,000. Our 25 to 29-year-olds just over 2,100. But it's increasingly going up again in school-age children. Clearly, the Christmas holidays has helped, you know, families testing, etc. But you can still see that our rates are approaching 1,700 in our 15 to 19-year-olds, 1,500 in our 10 to 14-year-olds, 1,200 in our 5 to 9-year-olds, and even in our 0 to 4-year-olds, you can see a rate of 710. It is, you know, still also going up in our older age groups as well, and this is partly the Omicron variant. You know, despite good vaccination rates, we are seeing infections in these older age groups creeping up. But pleased to say that again, in terms of serious illness, less likely to be seriously ill if you've been fully vaccinated and boosted. So again, the benefit of that really coming, and when we go into hospital data, you'll see that. So in terms of patients with COVID admitted to hospital and patients in hospital, this is up to the 6th of January. This is London data now rather than South West London data. Again, you can see the current wave, the 2022, January 22 wave onto the far right-hand side of the graphs in terms of patients admitted to hospital. It's not as high as last January or April 2020. Again, the benefit of the vaccination, meaning that we don't have as many people admitted to hospital, seriously ill, and a high proportion of people are admitted for other things and then found to have COVID. So again, it's when they have their routine testing as an inpatient, they're found to be positive, but they don't actually have any symptoms for COVID. So again, the importance of testing being so vital. So again, we don't necessarily get data every day, but in terms of total numbers in hospital on this particular day, 6th of January, was just over 4,000, 4,053. Our local outbreak management plan, so this is Kingston's Keeps Kingston Safe local outbreak management plan for COVID. We're on to version 7 of this, so this is where we keep all the documentation of how to handle an outbreak, all the communications, all the prevention messages, all of the infection control advice for different settings, so be it nurseries or schools or workplaces, etc. This latest version was signed off. We're on, as I say, version 7.1, because every time we get new guidance, we have to update it. So the most recent guidance in January will be added, and that's changing virtually on a daily basis at the moment. And we are still having 3 times a week data meetings to look at the picture in Kingston and looking at where we've got higher rates of infection, either by location or maybe by workplace, so that we can work with the employers, for example, and make sure that any outbreaks are got on top of as soon as possible. In terms of testing updates, we know that, as I said, we had high pressure on our lateral flow devices and our PCR testing slots, our local testing sites, and we had to use our staff to distribute what we had, eke out our supplies of lateral flow tests to make sure that we had enough for our higher risk settings, we had enough for our return to school testing, and we were able to support all of our secondary schools with a round of one-off on-site testing with over 8,000 tests completed in our secondary schools, and supporting any, as I say, any high risk settings with any outbreaks. And we've had changes to testing for contacts, so, and also for people that are going to come out of self-isolation to release early in having negative tests on day 6 and 7. So quite a lot of changing with testing happening. And because of Omicron, and because of people being vaccinated and many people being asymptomatic, this is where regular testing is so important to detect COVID when people are infectious but are not having any symptoms. And just a reminder that free rapid lateral flow tests are available from Kingston Market House. We have our mobile test teams. Pharmacies are, if they have supply, are doing collections, and you can order online, and there are a daily amount to be ordered online. So a recommendation for people to go on early in the day, because you are more likely to be able to order your 7-day home test sort of supply. So really important to have your tests at home ready to use, either for, if you're going to be mixing with people that you don't normally meet, if you're going out, or as part of a regular programme for school settings, for example. Health and social care settings, workplaces have their own specific testing rules and guidance. So again, those places following that. And as I say, all pupils in secondary school and staff and people working in school taking twice weekly tests. We've got various posters with the various messages going out at the moment. From the 11th of January, because of Omicron and the sensitivity of lateral flow tests to pick that up, if you get a positive lateral flow, you're highly likely to have a positive PCR. So they changed the guidance from the 11th of January that if you have a positive lateral flow, you don't need to book a confirmatory PCR and you should self-isolate immediately. And that's as long as you don't have symptoms. If you have symptoms, you still need to get a PCR test. And people should be registering their results of their tests. That's easy to do, particularly if you've got a sort of a mobile phone with a scanning device that can pick up the QR code, but you can manually type in the code too if people don't have that. And this is a sort of temporary measure whilst our COVID-19 rates are so high.
Iona, apologies for interrupting. I have a question in the chat function. Would you wish questions at the end or as we go through?
I'm happy if it's to do with the content I've done to take that now. Thank you, Fiona.
Yes, so the question is from Councillor Christine Stewart. What percentage of pupils have agreed to follow testing guidance? There are reports saying that significant numbers are refusing to be tested and also to wear masks.
So I'm pleased to say our uptake in Kingston has been really good. I think we've worked really well and really closely with our head teachers, staff, families and students. So we had really good uptake. It does vary a bit by year group, I will be honest. So older children, young people, I should call them really, partly the smaller number in those year groups. So it does vary a bit across year 7 through to year 13. But we had really good uptake. We had really, really good engagement. And I think that's partly the communications we sent out before Christmas, as well as, the engagement we've had. And I think many families and young people feeling the benefit of knowing their COVID status. I know that's not been uniform across London, for example. So parts of London haven't had anything like the uptake. I haven't worked out the percentage. I have had the data of the number of tests by year group, and it was, as I say, into the thousands, over 8,000, with a handful of positives detected. So it was good, that we'd done the testing, because that helped protect schools, so we didn't have positive cases re-entering into the school community, if you like. But I can't tell you off the top of my head, Councillor Stewart, what our percentage was. But as I say, the feedback and the benefit, I think, of having testing teams supporting the schools, the school staff, the teams in school is testament, I think, to the relationship we've built up. So it's not been something of concern, if you like, in Kingston, I'm pleased to say. The same with mask wearing. Again, really good uptake of mask and adherence to mask wearing. So again, I'm pleased to say, again, probably a variable across the schools across Kingston, but in general, really good compliance. Clearly, what people do after they leave the school gates, I know they're encouraged to wear them, even travelling to and from school, and certainly on public transport. But certainly in school, there's been good adherence.
Iona, I just had a very quick question from Councillor Ryder-Mills on the previous slide about what's the logic behind only needing a PCR if you have symptoms. I thought that was an interesting question. Yeah, but happy to take that at the end, or can you?
Yes, no, I can take that one now. Partly just to make sure that if it is COVID that you've got, and also that a proportion of PCR tests are sent away to be genome sequenced. So we've got a higher chance of picking up other variants. Clearly, if people are only doing lateral flow tests, there's no laboratory element to that. And we still want to be able to pick up new variants that potentially develop or come in. And therefore, people with symptoms getting a PCR test means that we will have a higher proportion having the genome sequence for their sample. So moving on to, that's okay, to local contact tracing. Just to say, clearly, this is the support that we're offering to people. We know people that get support are more likely to be able to stick with their self-isolation period. So we've had our own local team since November 2021. This is a 7-day service with both phone and home visits to the door. We're consistently in the top 5 of London boroughs in this for the number of people we're able to contact and trace. We work with Department of Health and Social Care and the national team about our local model. And it's particularly to offer support, as I say, offer things like access to food, if they need access for financial help, for example, if self-isolating is a problem. Some people eligible for the national scheme. We have our own local voucher scheme, and also social support. So, staying well at home too. And since our local service started in November 2020, we've completed over 5,323 contact tracing, done that contact tracing with that number of residents, and made over 2,376 doorstep visits to residents. So huge benefit, and the feedback we get is really, really positive from that extra support. As I say, those that have had to shield, some of there's been changes gradually over time. But again, when people have been shielding, we've been offering them support and offering them a sort of COVID-19 service, both from our volunteers and civil partnership colleagues. As I say, where people are now asked to self-isolate, we're supporting them. And we've had over 800 residents just in December alone. When we've had such high infection rates, you can imagine that's a lot of people to support. And again, that's available to anybody that's having to self-isolate. In terms of payments from the national scheme, we had 629 grants administered in 2021, and from our Kingston voucher scheme, as I say, for people that wouldn't be eligible for the national scheme, we've been able to help 368 households up until December. So I'm going to hand over to Naz Giovanni now to do a bit of an update on the sort of South West London vaccine update and the boost that happened nationally. Over to you. Thank you.
Great.
Naz.
Thank you, Iona. So we're just going to run through a few slides on the vaccine update for Kingston and also for South West London. As you probably know, and you're very well aware, that the vaccine programme was significantly increased and accelerated just before Christmas because of the increase in the Omicron variant. There was a real national drive to actually increase the number of boosters, because we knew that the third or the booster vaccine would actually give you better protection against the Omicron variant compared just to the two vaccines. And over that 3-week Christmas period, we've done over 220,000 vaccines across South West London. And that is mainly due to the help of the volunteers, not just the clinicians, but the NHS volunteers, the army, local authorities, having to work virtually every day of that holiday period, including the bank holidays. We do still continue to see increasing numbers of people coming forward for their first doses. So the message is that it's never too late to get your first dose, and then subsequently your second and then booster doses. We've been engaging with local community, moving to the streets and making sure that we try and catch people through the festive season, giving them clear access to very clear information, and actually talking about any concerns or questions that they have about the vaccine itself. And this is largely done through the street ambassadors who have gone into local communities to speak about the vaccine and answer the questions. They've had around about 400 to 600 conversations with different people across South West London, and we've had significant numbers saying they intended to have a booster, and over 50% reporting that they'd already taken up the offer. So it does work. Can I have the next slide, please? So the next slide shows you the numbers across South West London that have been of the vaccine uptake. So in Kingston, across our population, we've had 130,000, just over 130,000 taken up the first dose. We've had just under 120,000 taken up the second dose. And then we've had around about 87,000 taken up the booster or the third dose. So that's around about 61% uptake, which is actually residing very closely to the national average as well. And then you can see the comparisons amongst the different boroughs, and also the total numbers across South West London. And this is from last week's data. So can I have the next slide, please? So currently we're still running with quite a strong messaging around making sure that you take up your booster vaccine, and it's not too late to take up your first dose vaccine as well, to protect yourself, your family, and particularly against the Omicron variant, which is persistent at the moment. We're currently having booster bookings for all those aged 18 plus, but they have to be 3 months after the second dose. People aged 12 to 17 can book their second dose of the COVID vaccine with their families through the national booking system, or there is this a slot which is called Grab a Jab website, very catchy phrase, and that's got to be 3 months after their second dose. So that's the booster dose. Anyone eligible for a first or second or booster jab can book a convenient appointment time online through the National Booking Service, or they can dial 119, or they can do walk-in clinics across South West London. And there's the website address talking about the walk-in clinics, because sometimes people have some difficulties. We've also had some conversations with people getting vaccines from abroad. There is a very clear guideline as to what is accepted within the UK, and how it fits into our second dose and booster programs, and when they should be taken on board. So they're very clear guidelines. So we're not missing the trick around people getting boosted or vaccinated abroad. Can I have the next slide, please? So we've in the vaccination clinics in Kingston, Hawks Road Clinic, obviously you've got the opening hours for 12 to 15-year-olds, 3 to 6:30. That happened this Tuesday and it's happening tomorrow. And then also it's open in the afternoon again yesterday and also on Sunday. We've got 16 plus first and second doses and 18 plus booster walk-ins. And that is in the morning time on Tuesday, Wednesday and Friday this week. And also all day Thursday, which is today, and also Saturday. And then we've got Sunday mornings as well, being able to help with the first and second doses for 16 plus and booster doses for the 18 plus. And pharmacies are helping out with the booster vaccine program and the other first and second doses throughout the borough as well. Can I have the next slide, please? So, as I said, having a range of, right, okay. Right, okay, I'll stick to this one because the last slide was just mainly around the walk-in clinics, and actually having the range of walk-in clinics that we've got means that people don't have to plan, they can just pitch up, and we should have the information on the database at the clinics themselves. So next slide, please. And so for the rest of this month, we are still focusing on making sure that we're getting people their vaccinations, and particularly with the mandated guidance that's come out around health and care staff being mandated to have the second dose vaccine by the 1st of April, which means that they have to have had it done within the first week of February to be able to qualify to get their second dose done. And obviously trusts and other organisations are preparing as to what to do. There's a big drive to try and help the trusts and the staff in there to actually understand more about the vaccine programme, to try and see if those ones who are still not vaccinated will take it up. And obviously, just as an update, the 12 to 15-year-old second doses are now available through the National Booking Service. And also the school second dose offer will be shared with parents and carers this week. The 5 to 11 for the clinically extremely vulnerable children are available through primary care, through the vaccine clinics. And the 16 to 17 boosters, these are only available for the clinically extremely vulnerable at the moment, but they will come online later on. So can I have the next slide, please?
I think that's handing back to me now, Naz. Thank you.
Sorry, I thought there was one. All right, okay, thanks, Iona. I'll hand back.
Thank you, Naz. So this is fairly hot off the press. Obviously, we've been working a lot with our communities and voluntary sector groups around on the whole COVID journey, and including vaccination. And we've had various pop-ups that have been successful. And just before Christmas, the Department for Levelling Up Housing and Communities announced that they had, they had a pot of money to receive bids for vaccine champions, and Kingston was on the list of boroughs and areas of the country where they wanted to receive bids. So we submitted one. We had to do a very quick turnaround, and we heard last Friday that we've been successful. So this is for funding for £485,000. The slight caveat, it has to be spent over the next 6 months, and it really is targeted for closing the gap for groups that haven't taken up the vaccine, and those are often called hard to reach. It often means actually that the way we're trying to reach them hasn't worked so far, and therefore how we can work more closely with those communities, answer their questions, take the vaccine to them, make sure that the information is in their languages that they either to read or they would access, to try and make sure that we can that everyone's had the opportunity to take up either their first, their second or their booster dose in our communities. So our bid is building up on the work that we've done already. So that's things like going out to our underserved communities. As I said, we've had things like pop-up events already at Kingston Moss, for example, and Surbiton's YMCA for those that are experiencing homelessness or vulnerably housed. So again, sort of doing that type of outreach approach we'll be doing even more of over the next 6 months. We'll also be doing more with our community development approaches to, support people that have got potential barriers to accessing the vaccine, either, for where they are in the borough geographically, as I say, or maybe if they don't have English as a first language. We've done some work with South West London CG already with 8 different groups, and that was particularly looking at people aged over 50, and that was things like translating videos of vaccination into Korean. We had a Facebook page start up for Gypsy, Roma and Travellers. One of our voluntary organisation, Oxygen, the staff there posted videos of themselves receiving the vaccine and taking a test to help try and reduce anxiety and promote discussion with young people. We've also had Surrey Community Action that have been working with our team, working at our local settled Gypsy, Roma and Traveller community site. So it's those sorts of bespoke measures, if you like, where the sort of mass communications has perhaps not been working, that we can go and work more closely with communities. We're also using a variety of media, including sort of physical signage, but also social media, newsletters, websites, VCS groups and others, amplifying the sort of national and regional messaging, but also creating our local data. And these are just some of the sort of 2022 New Year community messaging that we've had, working in partnership with an NHS colleague, so out and about promoting what's available. And also we've got other billboards and things like that, as well as the van. As I say, we're doing work with our VCS organisation, so we funded 25 of those with small amounts of money, as I say, to do local translation, local promotion, to get the messages out. And I also do a fortnightly sort of keeping up with the data message with these groups come along so they get the most up-to-date information. And we just had the 38th of those this week. We've got new communication messaging as well, the importance of mask wearing. As you know, under Plan B, people encouraged to wear masks when they're out and about in crowded places and enclosed places. So really encouraging the difference that wearing a mask can do. So this is quite new, as I say, communication messages that we're using, that it's not just, frontline colleagues that should be wearing masks and saving lives, that people out and about can absolutely do the same too. Real importance around ventilation, and there's various different videos promoting that. I'll skip that now because I suspect it may not work with the sound today, but it's just showing that the way that COVID-19 gathers in the air, a bit like smoke, and that therefore if you open a window, you can disperse the particles and stop COVID-19 hanging around. We've got lots of digital marketing looking and promoting our vaccination sites as well. And as Naz said, we're creating information so people get the latest of where our walk-in places are and can access it. And that includes our pharmacies as well. So I'll stop sharing now because that's the formal presentation finished. Thank you, Councillor Sharper.
Thank you so much, Iona and Naz, for that. I do have a few questions, and if you, I've got 3 to start with, and then if you'd like to put your name, just your name first name in the chat function, I can then get you to ask your questions. But I have 3 from Councillor Abraham, and is what's the position in relation to staff shortage or staffing issues in Kingston Hospital? And if that's the first question, would you like me just to do all 3 in one go and then answer them like that in that order, if that's helpful? Yep. But the second one is, those admitted to the Kingston Hospital, are they the unvaccinated in Kingston? Is there a sense we can get of what's happening with transmission rates? I think that's really important. And then the last question from Councillor Abraham is, are pharmacies able to give the second dose for 12 to 16-year-olds? Because obviously, as we know, they've played a vital role in the vaccination programme as well. So that's the first few questions that have come through. As I say, please do put your questions in the chat function, or your name in the chat function. So I shall stop there for a second and perhaps hand over to you, Naz, on that one.
So I'll take the second question first. So the unvaccinated in the trust, we do have data going back to October last year, so pre the Omicron spike, that showed actually vaccinated and unvaccinated were 50-50 going into the hospital because of the tailing off of the antibody response from the second doses. Since December, we've noted that there has been a big shift. So you're twice as likely to be admitted if you're unvaccinated compared to if you're vaccinated. And as the booster program has been taken off as well, we've noted that whereas in the previous waves, we've seen the wave go up about the admissions. And we've also seen a similar wave go up for over 60-year-olds, which is slightly lower, but similar. But this time round, we haven't seen that peak. What we've seen is a much flatter rate of admissions for over 60-year-olds, and actually they're starting to slowly come down. And I think that reflects the booster program that we've got currently. It's made a significant difference to the stresses on the hospitals themselves. I think the combination of the numbers going through the hospital from previous waves, also combined with the number of staff that are off isolating on this wave, I think would have collapsed the NHS completely. So currently, it's protecting staff, it's protecting the patients from being admitted. The numbers are slowly starting to fall across London. As regards staff shortages across Kingston Hospital, I don't have the numbers with me. I do know that they are suffering some staff shortages, mainly through the isolation rather than through them being unwell. But it's mainly through isolation they're having they're having staff shortages. So they're having to look at what they do provide within the trust and just reallocate some staff to the higher intense areas of the hospital. I can get the numbers for you, but I don't have the numbers with me.
Okay, that would be helpful, actually. I was about to say, if there are any questions that we can have answers to maybe afterwards, Fiona Cotter, our Democratic Service, I was very happy to take them in written form and then forward them on to you, Naz, and your colleagues, and same for Iona and Martin as well, that are on this meeting.
And the third question I'll hand back to Iona around the pharmacies.
Thanks, Naz.
Yes, so in the lion's share of the 12 to 16-year-olds, it's been through the school delivery programme at school or at hub sites. So, and again, they're obviously coming around for their second doses now, and that's going to be delivered either at schools, particularly the larger schools, with hubs for sort of people to be able to book there. So my understanding, I don't believe pharmacies are doing the 12 to 16-year-olds. I think they're being doing through either the main hubs, such as Hawks Road, or the primary care network hubs, rather than the pharmacies for that age group at the moment. Clearly, as we have more capacity, it may be that will change going forward, but that's the current situation as far as I'm aware, Councillor Abraham.
Thank you, Iona. And I think Councillor Abraham, did that answer your questions? I think that's all the questions you gave.
Madam Chair.
Sorry, say that again.
Can I just follow up on that? What Iona just said. Yes.
Yeah,
the position is that I'm aware when the first doses were given, schools, I know some schools were really, really active. Some weren't very active on that. Now, the second dose, is it the decision taken by our public health, that's our in the local authority, that says, yes, pharmacies can give it, or does it have to come from government? How is it working? I'd just like to know that.
Yes, it's a clinical decision on where the trained staff are. So it's not a local public health council decision. It's all of the administering of the vaccine is NHS protocol, and working closely, obviously, with our NHS colleagues. And it's to do with having paediatric vaccinators. So that's why it's different for over 18s than under 18s. And that's why, again, those that are clinically extremely vulnerable getting invited in to be delivered it by their GP in the primary care network hubs. So it depends partly on the medical risk as well as the age cohort and the paediatric vaccinators versus adult vaccinators, because the protocol is slightly different. So that's why it varies, and that's why schools have been a sensible place to start this off, because it's obviously where young people are. But people, it's not the only opportunity you've got. As I say, often families booked for their 12 to 16-year-olds to have it elsewhere, back at primary care network hubs or Hawkes Road, for example. And I think, we can see a strong correlation between more affluent boroughs, such as Kingston, having higher uptake in younger age groups than, boroughs that are less affluent. There seems to be quite a strong correlation. So when we look across London, we can see boroughs with higher rates of deprivation having lower uptake in younger people, which, and across most age groups, in fact. You saw the South West London data with Croydon falling quite a lot further behind many of the other South West London boroughs, and a strong correlation with, as I say, more affluent boroughs in South West London having higher uptake of the vaccine across all age groups in comparison with our more deprived boroughs in South West London.
Thank you.
Thank you, Iona. I have a question. Apologies, Councillor Stewart, because I know you sent in your question in advance. Would you like to just repeat your question now on the call now? Would that be helpful? And then maybe I can direct it to Naz or...
Yeah, basically, if we come out of the pandemic and go into the endemic situation, but other countries that don't have a high rate of vaccination are not so fortunate, and so new variants develop, how vulnerable are we going to be as a country, because we will have come out of the intense pandemic stage?
Thank you, Councillor Stewart. Is that something, Naz, you would be able to come back on?
I'll come back on it, but it's I really don't want to speculate, because this is actually trying to predict the future. So there are several variables here. I think that we need to, obviously we've got an awful lot of learning from the last 2 years that the pandemic's been going on. So there's been an awful lot of learning around people coming into the country, different variants coming into the country, and ways of being able to control that at the borders. But I think that there are several things that we need to look at in the future when it starts becoming, when it starts transferring from a pandemic to an endemic. So as regards, because I'm not sure whether people understand that actually an endemic infection basically means there's a persistently low or moderate level of disease in the given geographical location. So that's the actual definition of it. So if we're looking at it in the future, it really depends on infectivity rates, transmissible, depends on the seriousness of the disease. It depends on the vaccination status of the population at the time. It also depends on whether the vaccine is going to be effective against that new variant as well. And finally, it really does depend on what SAGE advises the government and the instructions that are sent out nationally on this. So unfortunately, I can't give you a black and white answer on this, because there are so many variables that we would have to take into consideration. And ultimately, it would be messaging that would be coming down from the government based on scientific information.
Thank you, Naz. Councillor Stewart, did you have a supplementary at this stage? I know I think you did put in the chat function a previous question. We may have covered that one earlier.
You covered the other one earlier. The only other question I would say, is there anything that we as a country could be doing to be more proactive about getting the vaccines to other countries?
Yeah.
Thinking especially of working against pharmaceutical companies blocking the removal of the patents.
So I agree. I think the only way getting out of this pandemic is actually making sure the population as a whole across the world is offered the vaccine and they take up the vaccine. Unfortunately, that sort of bit is a real political decision and it's way out of our hands. But I do agree with you. It is something for us to be able to come out of pandemic. We need to have a very high vaccination rate across the world.
Thank you very much, Naz, for that. I received a question from a resident, but it was she just wanted me to not mention her name, but we just asked if I could actually say it on her behalf. One of my burial insurers. It's an interesting one. She's saying it obviously takes time to get people vaccinated. It's a program that you know, we want, there's like that's an ideal figure that you get people, number of people vaccinated, you know, in our borough, say, for instance, and across Southwest London. But the question is there kind of a strategy where you look at what's worked so far, and you have an idea of projected numbers of people who would get vaccinated by a certain time? So the question is, do we have a longer term aim about the getting a regular booster program as part of our was that too early to say what's going to happen? So that was really what that resident was trying to ask. Thanks.
So I think it's too early to say, and I'll pass on to Iona, because obviously she's got a lot more experience on this. But ultimately, it has to be followed by the data and followed by the evidence through that about the following boosters that would be occurring in the future.
Yes, I'd concur that it's a bit too early to say. I think what we do know is that the coronavirus changes the proteins on the surface, which is the whole way in which vaccination, creating antibodies, it works, and therefore we know with the different variants. Apologies, it looks like my signal might be a little bit unstable. I hope you can hear me all right. Maybe I'll switch my camera off, and that will make it better. So we know that, as I say, coronavirus changes, the proteins change on the surface. We know the different variants that we've seen already. So Delta kind of last Christmas, and Omicron this Christmas, and therefore you may well know people getting coronavirus twice. And again, that's an indication that it's changed enough that you can have a reinfection. So that would tend to mean, and as we've seen, the booster helps prevent serious infection. It may not stop you getting an infection, but it will stop you getting seriously ill. So using that information, it's likely that particularly we might need to look at protecting our more vulnerable residents, so those with an immune problem, for example. But again, I think until we've got more evidence of the benefit of triple vaccination, the current programme, and therefore who would need to be boosted in the future, we'll have to rely on the learning that we're getting at the moment. But certainly the evidence to date shows that we need several vaccinations to get sufficient immunity to protect the majority. And as we work through the different age cohorts, again, it seems that older people need more. Younger people may only need to have a couple of doses. But again, we've only started vaccinating our young people in this country, and therefore we'll need to see what the benefits are for them going forward. And again, that's where SAGE is so important, looking at the science, looking what's emerging across the world, because again, different countries taken different approaches. Some countries have been vaccinating their children and young people much earlier than we have. Rightly, we protected the older, more vulnerable for very serious illness earlier. And I absolutely agree with the point that we're making earlier on about the global approach, because again, the sooner we have global vaccination, the less likely we are to have such high rates and much more risk of new variants of coronavirus developing. But I would also be an advocate for all of our vaccination programs. And clearly we're talking about coronavirus today, but, you know, I get to see infections of other illnesses, measles, mumps, etc. So our whole vaccination program is vital, and I'm really hopeful that it will get much more, airplay and time, and people will take it much more seriously going forward, for, prevention being far better.
Thank you, Iona. I think, Naz, you had your hand raised, and then I've got a question from Dr. Souza. Thank you.
So it was just to say that I think we're in a very strong position because of the research that's gone on with the mRNA vaccines around trying to adjust them for future variants if the need arises. So I think that I've got a feeling that the world is in a better place for what's happened as regards the mRNA vaccines, and the adjustments can be done at a much quicker rate.
Thank you, Naz. Sorry, did somebody want to come back with a supplementary? Sorry, I didn't catch that. Oh, there might have been a little bit of interference on the line there. Sorry. So I have a question. Thanks, Naz. I have a question from Dr. Souza. Is it just the under 18s that have to wait 3 months after having COVID before the next vaccination?
It is because with the adults, they have to wait 28 days, but as regards the under 18s, it is 3 months. Unfortunately, you have to wait 3 months.
Thank you. I haven't got any further questions. I just got one really, just to say, in one of the slides where we looked at that greater number, the clusters of 20 to 24-year-old, the take up for the, I think there was to the rates, wasn't it, Iona, on that slide? Is it inevitable to some degree that there might be, as time goes on? Because I remember Hop asked Tonya this at the beginning, sort of in the July of 2020, that as time goes on, is it inevitable to some degree that there might be sort of fatigue setting in or perhaps sort of what's the word, reluctance to take up a vaccination? Because actually, is there, as you say, is there data that comes through to tell us that actually we are preventing that critically ill level hospitalization? But is it trying to get the message across that actually no matter what age you are, there's always that risk that you could end up seriously ill, therefore it is better to be vaccinated? But is it more about also transmission as well and spread?
So the more virus that's circulating, the more risk, obviously, of onward transmission and it getting through to people that are going to get more seriously ill should they contract the virus. And it may be that's because they've got another illness as well, and that having the virus on top of that is enough to tip them over into hospital admission, for example. So we still have, 1 in 5 of people in Kingston not fully vaccinated. So, clearly that presents 1 in 5 out there. That is a concern. But that's why we need to keep speaking to these people, having individual conversations, trying to get behind what's stopping them take it up. For some people, it is still access. If you're a 12-hour shift worker, have to travel to and from work, you may just not have managed to physically be able to get to a vaccination centre when it's open, which is why, weekend hours, earlier starts, later finishes. We do know a few where, 24 hours over the sort of Christmas period to try and make it more accessible. But what we want to do is try and make it as easy for those people that for whatever reason still haven't come forward and either started, and we do know that some people are coming forward and having that first vaccination, and therefore trying to keep the message fresh, the why you should, both for yourself but for your family, for your friends, for other things you might want to do. And we know that different messages work for different age groups. So a message that's going to work for a 50-year-old is going to be different to a 25-year-old. And when we look at some of our data, we saw that our sort of 20-year-olds weren't quite as high uptake as some of the other boroughs in South West London. So again, using messages that are more likely to engage them. When we look at travel, for example, countries that are requiring vaccination for travel may be a motivator. Clearly, if it was required for access to a nightclub, which it currently isn't, you don't have to be vaccinated. You just have to have a negative lateral flow for the larger venues. Those sorts of things. Try and get the message to say, actually, if you want to live the life you want to live, if you want to be your best self, then being vaccinated as part of that will give you more choices. So again, I think trying to target our messages to the target audience, but answer questions that people, genuine questions that people have, to make sure they're well informed.
Absolutely. And just to clarify, when I say reluctance, it's not like there could be very many reasons why people aren't having the vaccinations. As you say, there's so many different reasons. It's a positive message, actually, that we're trying to get across, that it's a good thing to get vaccinated. And so I've got hands up for Councillor Abraham and then Councillor Stewart. Thank you. So Councillor Abraham, if you'd like.
No, Councillor Stewart, go first.
All right, thank you. Councillor Stewart, thank you.
Hi, thank you very much. I'm still very concerned about the people who are immunosuppressed and have been shielding. I've recently met or come across a person who has motor neuron disease and has been told that if she were to get the disease, it would kill her. Now, with the variation in going from Delta to Omicron, is there any hope that that risk is lessened because of the change in the mutation?
So I'll come in first, and then if Iona picks it up as well. But we know the Omicron variant is the early signs are it is not as severe a disease as the Delta variant, but the transmissibility is much higher. So therefore, people are more likely to get infected. Now, the ways that we need to make sure that people are really protecting our most vulnerable in the population is to make sure that the general population are protected with the vaccine, because then that lowers the transmission and that lowers the risk of passing it over to those people who are really quite vulnerable. Iona, I don't know whether there's anything else you want to add in.
I think it also, just to add to that, is the other prevention messages, to keep up with those. So, the mask wearing as well, for example, the regular testing. We know that because Omicron seems to be a more mild illness for many people, not everybody, but many people. And if you're vaccinated and still catch it, you may have no symptoms. It's actually the regular testing will help pick it up to make sure then that you self-isolate. So it's making sure you're still doing the mask wearing, the hand washing, the ventilation, the fresh air element as well, to make sure that you're reducing the risk of onward transmission and doing that regular testing in the background, particularly if you're going out or mixing, so that you're reducing the risk, because we find lots of people actually, when they do the test, hadn't realised that they were positive, and can clearly then act on that result and reduce the risk of spreading it to others. But clearly, yes, that protecting of others by doing the right thing yourself is vital.
Thank you, Iona. Thank you, Ness. And I've got Councillor Abraham with your question.
Thank you, Madam Chair. First comment I'd like to make is in relation to the pharmacies. As we know, I remember when it first started all this, I asked about pharmacies. The uptake wasn't very much in relation to our NHS trying to go to them. But I must say that after the pharmacy has stepped up and stepped in to do this, I know for a fact that the number of vaccinations they have been giving, and I must say we must thank them for coming up, stepping up to it. I know the sister pharmacy down the road here, they start from 8 o'clock in the morning till about 9 o'clock in the evening, and they are vaccinating left, right, and center. And it's fantastic. So we need to thank them for what they're doing and actually pulling out all the stops. One question I have is in relation to our nursing care homes and things like that, and staff being vaccinated. And do we have any idea what the position is? Have we encouraged them to do so? Because we know about what the government has been saying. If you're not vaccinated, you've lost your job, etc., etc. But that is something I was concerned, because I know from what I have spoken to people that the staff in the care homes, they do have difficulties, the numbers. So whether you all know anything different, what's the position in Kingston? I'm not concerned outside Kingston at the moment. I want to know what we are like in Kingston and how we are carrying that forward, because that's very important that they are, properly vaccinated because of our elderly population that's there. Thank you for that.
So I'll just tell you what we've done as regards care home nursing staff. I mean, we've been supporting them throughout the pandemic, not just with the response to COVID positive patients, but also in response to their needs around the vaccinations of their staff. So we've been holding seminars with them, we've been holding discussions with them, open fora with them, with the staff, to actually have a very frank and open question and answer session to talk about the pros and cons, and to actually hopefully give them the right information to make a correct decision around the vaccination. So we've been supporting them. As regards to the numbers, I do know that obviously the mandate came in last year, so we're beyond the mandate, but we're now starting to get into the mandate for the rest of the health and care staff from the 1st of April. And I know that the numbers are around about 8 to 10% that are unvaccinated at the moment, and there is a big push with information and with correct information to be able to help those unvaccinated staff make the informed decision that they need to make. So Iona, I don't know whether you've got the numbers though.
Yeah, so again, that close working with care homes did see the care home staff, because their deadline was ahead of the other NHS and domiciliary care staff. So there was a real push sort of through until November, I think their sort of date was. And we were down, I think, into single figures of staff that hadn't been vaccinated in care homes in Kingston. So, again, you're trying to work with people, and clearly they don't want to lose their jobs, very committed to their job. So, trying to understand that their hesitancy, work with them, answer their questions, do one-to-ones. And I know that's the same approach that we're using as we do the wider NHS and care staff, because clearly, we're struggling to have enough carers, domiciliary care workers, frontline staff in hospital. It's not our wish to lose them, but clearly protecting patients, protecting residents are vitally important. So understanding why people are hesitant and trying to work with them are crucial. And, with Omicron, even vaccinated people, we have got a high proportion of homes with outbreaks, for example. So work with them closely to try and make sure that chains of infection are broken and that we can get back and have homes ready to take admissions.
Thank you, Madam Chair. I've got a follow-up on that in relation to mask wearing also, because I'm concerned. I was in Marks and Spencer's just day before yesterday, and I must say the number of people not wearing masks, and staff was speaking to me and they were saying they can't say anything. This gentleman was in the fitting room coughing. His adult son and young, none of them were wearing masks, and the lady was finding it very difficult to tell them because they get abused. What's the position? What are we doing within these shops, and what is really happening? Because it is of concern if, I'm sitting there and I can see it. So I had to move out because obviously it's in a fitting room, not really the right place for a member of staff to be standing. And she was very concerned. So she's in her late 60s. So I don't know what the position is.
Yes, so we do work, particularly if we hear sort of complaints, have premises raised to us. We work with our regulatory services, so our mental health colleagues, our COVID marshals. We either go and visit them and see what practices they've got in place. Clearly, when it comes to stores insisting or requesting people, it's usually at the door as people enter. We've worked with Bental Centre, John Lewis, most of the main shopping either sites or locations in Kingston town centre, but also other parts of the borough, to encourage that good practice, because clearly they want to keep their staff well as well. It's again treating people fairly and doing the right thing to protect others. If we have got evidence of it not being adhered to, most doors will have mask wearing required. Often it's the security staff that are asking people to don masks as they come in. We have been giving away packs of masks, particularly leading up to Christmas, so that people can't say, well, I haven't got one on me, just to try and make sure we were trying to prevent the spread of Omicron. So, we continue to do that. Clearly, it's hard to do it all the hours that they're open. But again, it's working collectively, both the businesses themselves as well as us trying to support them to do the right thing. So that's the approach we've been taking.
Thank you.
Chair, excuse me, you're on mute.
Sorry, you'd think after all this time I would take my mute button off. Apologies. I've got two raised hands, Martin Ellis and Councillor Stewart. I think, Martin, did you want to come back on one of the questions?
Yeah, thank you, Chair. So I did have data as at the 7th December on vaccinated staff in care homes for Kingston. So there was, for directly employed staff, 97.1% have been vaccinated with the second dose, and 88.9% of agency staff have been vaccinated with second dose. It's really good numbers. I think there might even be an improved position, but I think it's not seen as a significant problem for care homes in Kingston.
Thank you, Martin. Councillor Stewart, did you want to come in? You've got your hand raised. Thanks.
As a person who employs carers for her son, obviously I'm concerned about statistics. We've actually said that basically any employee we've got needs to be vaccinated, and fortunately they've respected that. am I correct? There is a loophole that for care in the home, it's not compulsory for them to be vaccinated. I just didn't know what the current guidance was.
Thank you. Thank you, Councillor Stewart. I don't know if
So,
Iona or Naz, you could come back in on that one, or
so I think it was I think the carers in the homes, the residential and nursing homes, were dealt with last year, and I think there's the domiciliary carers that you're talking about, which are going to be dealt with by the 1st of April. So so at the moment it's not mandated, but it will be. It will be mandated. Martin wants to come in.
I think specifically what you might be referring to, Councillor, is that this was a mandate for those that work in CQC registered care homes, was the previous mandate. And it's going to be something along those lines for health workers as well. So CQC registered sites. So unfortunately, an individual's home, I think may have been outside the loop, but we can certainly clarify that.
Yeah, I think it is quite a big outside the loop. And I think that concerns me a little bit, because I think some people who have carers coming into their home are not totally aware of that.
Yeah,
we always ask to see their passport, their proof of vaccination, and there it is straight away. So yeah, thank you.
Thank you, Councillor Stewart. I don't think I've got any further questions. I just had one of my own. I was just really interested in the slide where we looked at, the other local authorities in South West London. And I guess overall, what I would be really interested to know is, obviously, we're obviously not alone in all of this. We've got our other partners across South West London who are having the similar issues to us and so on. Are there anything that we've learned so far that we have been able to help each other? So we learn from them and they learn from us. I'd just be really interested to know, because South West London as an area, obviously people don't just live and work in the same borough. We share lots of different things. So I'm just interested to know how we can bring that back and use that to our, for our own measures that we want to implement in our borough. I'm just really interested if you could touch upon that. That would be great. Thanks.
I'm happy to start. Absolutely have regular South West London meetings. Certainly I do, with both other directors of public health as well as an infection management team, have that fortnightly looking at, hospital picture, for example. So we've absolutely shared, things like our contact tracing, what we've done in the different boroughs, what's worked well, both communications, but also, our voucher scheme, for example, for people that are not eligible for the national scheme, what difference it's made locally. Same things like guidance. So at the moment, looking at care homes with the period of an outbreak and how we look at doing a dynamic risk assessment with our care homes. So again, we're doing that on a larger footprint. Otherwise, you risk sort of, depending on which borough you are, you're getting a bit of a different experience, and that's not helpful for people. Same working with schools when we had school outbreaks, again, sharing guidance, template letters for schools, rather than us all reinventing the wheel, because actually, it's a communicable disease. It doesn't respect boundaries and barriers, and therefore, trying to make sure that we're sharing the burden, both in terms of producing materials, but we've got a good idea that it's shared. I know Croydon have been one of the ones that for people that are partially sighted or blind, they were producing materials, audio materials first, and then sharing them, for example. So as much as possible, we do try and share resources and good ideas and learning as well.
Thank you, Iona. I have a hand raised, Councillor Abraham. Thank you.
Thank you, Madam Chair. Sorry to ask so many questions. We must get these answers. The position, I just wanted to check in relation to, the slide, and I think that you put up where it talks about numbers, the percentage of vaccinated the residents in this borough. I was looking at it. We've got 69% in Richmond, which is only just our neighbouring borough, and we've only got 61. Why is there this difference? And is there something we are not doing that they are doing more than us? I don't know. I'd just like to know there. And another one is a comment, which I'd like you to be able to take away, is that people do not realise Omicron is much more airborne compared to the others. And I know there's touch and everything else still there, but it is quite serious where it's come airborne is concerned, and how much ventilation is required, and we must ventilate. So I think if you could, that slide you took out earlier showing that was very good, and maybe we could put out that a bit more on Twitter or on Kingston, something to make people understand it's airborne, because people don't realize that. They think you can sit in a room of 100 people and you don't have a window door open. They don't realize that actually this is dangerous. It's not just touch alone. So that's the comment I have to, but the first one I'd like to answer. Thank you. And I won't ask any more questions, Madam Chair.
Yes, I think that little infographic and the little, image with a sort of COVID collecting a bit like smoke has been one that's been quite useful. And we have been putting it out on our Twitter feeds and different socials as well. We've been doing something called programmatic marketing. So we can see where, either we've got hotspots and then we target that geographical area. So when people go on their computer, you get the little pop-ups down the side, it coming up. And we are able to see quite well that when we target messages, we get better uptake. So trying to use that kind of approach in a targeted way is very useful. In terms of, why are we lagging behind Richmond? It's a bit hard to say exactly why. They've been ahead of us on most of the age groups across the board. In terms of schools program, their schools had teams going in a little bit ahead of us. So whether, again, there's a slight difference that they've had, they're getting around to their second doses, for example, earlier than us. So it's partly team dependent. As I say, I think our 25 to 29-year-olds have been a little bit behind when we compare age group by age group. We could see, and again, whether that was people who felt that, this was looking at pre-Christmas data, that they didn't want to be unwell before Christmas. They didn't want to, be changing their plans, for example. Again, that's why we've been targeting our messaging, going to places where that sort of age group congregate. They're often people that might be in less secure jobs, for example, and whether they felt that their job employment might be compromised. So I think it's partly understanding people a little bit more, and therefore what their particular barrier is. But in terms of being able to pin down why Richmond are a bit ahead of us, it's hard to say. It's probably an accumulation of lots of different things in reality. But that's why trying to keep messages fresh, saying it's never too late to start or have your next dose, and not trying to get vaccine fatigue. This is still really, really important. This hasn't gone away. And I think it's hard, both from a workforce perspective as well as a public perspective, to keep that engagement going. We had this massive push to the end of December, but, if we've still got 1 in 5 that aren't fully vaccinated, what are we going to do to entice those, to make it accessible? And that's where this sort of vaccine champion work is, hopefully to get a bit underneath that kind of 1 in 5 to try and make it as small a percentage as possible.
Thank you, Iona. I haven't got any further questions in the chat function. Appreciate the evening. We've finished our questions, but I just wanted to make a comment that obviously not to underestimate, as you say, the fatigue on not only within our borough, just general population, but also staff within the NHS, within our own council, pretty much everywhere. We know anecdotally of people telling us the impact it's had on mental health, on all sorts of other issues. And I think we're just really mindful that, we're sort of still in this unprecedented situation, and we're still trying to learn and gather data, and it's not over yet. It's that sort of, we have to keep vigilant. So just some of the comments in the chat functions, and just to pay, well done. This is a huge achievement, and congratulations to yourselves, to our health partners, to all of us who work every day trying to either work in the NHS frontline or just even with, other services, other providers. It is a really difficult time, and we just wanted to say thank you very much indeed. And also for coming on for preparing the slides for this evening's presentation. If anyone thinks of anything after this session that they didn't think of during the session, please don't hesitate to email either myself, my Vice Chair, Councillor Abraham, and Fiona Cotter in Democratic Services, and we'll ensure that those questions get forwarded on. But at this stage, I just want to say thank you again for your time and energy and commitments to what we're doing in our borough and across Southwest London. And it is now 19:47, nearly 10 to 8. And so if there are no further questions, I will announce the meeting as closed. So thank you very much indeed for attending.
Thank you.
Thank you
Thank
very
you,
much.
Madam Chair. Thank you,
Thank you.
everybody.
Bye bye.
Good night.
Good
Yeah,
evening.
thank you all.